Well, thanks, Jerome. And yeah, hi everyone. I'm Lois Beach. I am the Senior Research Officer at the HousingLIN, and I'm really pleased to be chairing today's happy hour in collaboration with ASH, who we worked really closely on with to support the report, exploring the kind of role of social housing providers in supporting their residents to reduce and quit smoking. And Robbie from ASH will be sharing the findings from that report today. But I hope that today's happy hour will demonstrate not only the kind of why, but also the how when it comes to supporting residents reducing smoking. So with us to answer that how and why, we've got Dr. Sarah Jackson, who's the Principal Research Fellow at University College London, who will give us kind of latest evidence in relation to smoking, social housing, and kindly provided lots of evidence for the report. As I said, Robbie, who it was a pleasure to work closely with on the report, will highlight the key findings. And then we've got two examples from sort of housing associations, social landlords who are already undertaking this smoking cessation kind of projects. And I hope, if you're at the start of your kind of journey thinking about this, that will be really interesting to kind of understand from their perspective how they achieve that. So first of all, we've got Madeline Jeffries, who's head of housing at New Tide Homes, which is part of the flagship group. And then Andrea McLaughlin, who's a public health practitioner at Sunderland City Council, and she'll talk to us about their Stop Smoking Sunderland programme. And we'll be taking questions at the end of the presentations, but please do feel free to post any in the Q&A as they come to you. And yeah, I will first of all then hand over to Sarah. Sarah, over to you to introduce us.
Thanks very much. Let me just share my slides. Can you see that?
Yeah, it's perfect.
Great. So hi everyone, I'm Sarah Jackson. I'm from the UCL Tobacco and Alcohol Research Group. And in this brief talk, I'm just going to take you through some of the evidence on social housing and inequalities in smoking, with a particular focus on data from the Smoking Toolkit study, which is a large representative survey of smoking habits in England. Tobacco smoking is one of the leading drivers of health inequalities. Risks of disease, disability and premature death are higher for socioeconomically disadvantaged groups. This graph shows data on the risk of men dying between the age of 35 and 69 by a range of indicators of socioeconomic position. So the white bars show higher rates of mortality among the less advantaged groups, those from lower social classes with lower levels of education and with lower income. But if we look at the grey bars, we can see that specifically these disadvantaged groups are much more likely to die from smoking, with tobacco smoking accounting for approximately half of the difference in the risk of death between the more and less advantaged groups. Higher smoking prevalence is associated with almost every indicator of socioeconomic disadvantage, and progress to reduce smoking prevalence has historically been slower among the disadvantaged groups. The available data overwhelmingly focus on occupational social grade, and this graph here shows smoking trends in manual and non-manual workers in Britain since the early 1970s. And it's clear to see that while smoking rates across all socioeconomic groups have declined over the years, large inequalities remain and have widened significantly in the last decade. Official data from the annual population survey show that in 2019, smoking prevalence was 2.5 times higher in people from routine and manual occupations than those from managerial and professional occupations. So around 1 in every 4 routine and manual workers was a smoker, compared with around 1 in 10 managerial and professional workers. And higher smoking rates are consistently observed across groups with greater socioeconomic disadvantage, but the data suggests that housing tenure is the strongest socioeconomic predictor of smoking. So using data from the Smoking Toolkit study, we compared the contribution of 6 indicators of socioeconomic position in predicting smoking status, and we used statistical analyses that accounted for the high degree of similarity across these variables. And the results showed that home ownership was the most strongly linked with smoking status. People who didn't own their own home were twice as likely to smoke as homeowners. And the odds ratios associated with other markers of socioeconomic position were lower, ranging from 1.03 for car ownership to 1.78 for social grade. And when we've looked at patterns of smoking in relation to housing tenure in more detail, we've seen it's not just people who don't own their own home who are at highest risk for smoking, but specifically those who live in social housing. In a study of over 100,000 adults in England, we compared people living in social housing with other housing types on a range of different smoking outcomes, including smoking prevalence, level of dependence, quit attempts, and use of cessation support. taking into account differences in other factors between these groups, such as age, gender, and the region they live in. We found that adults living in social housing had more than double the odds of being a smoker compared with those living in other housing types. Current smokers living in social housing smoked on average 1 more cigarette per day and had 50% higher odds of smoking their first cigarette of the day within half an hour of waking, indicating significantly higher levels of addiction. Their level of motivation to stop smoking did not differ significantly from those living in other housing types, nor did the odds of reporting regular exposure to smoking by others. Smokers living in social housing had 16% higher odds of having made a serious attempt to quit in the past year than those living in other housing types. And among smokers who had tried to quit in the past year, those living in social housing had 22% higher odds of using evidence-based cessation support, specifically e-cigarettes or prescription medication. However, they had 37% lower odds of remaining abstinent after making a quit attempt. Now, this doesn't mean that cessation support was less effective for smokers living in social housing. Once we took into account the fact that smokers living in social housing were more dependent on cigarettes, the association between use of support and cessation didn't differ significantly by housing tenure. And this indicates that use of support increased the chances that a quit attempt was successful to the same extent regardless of the smoker's housing situation. This graph shows annual smoking prevalence estimates over the study period. And there was a significant interaction between housing tenure and survey year, meaning there was a statistical difference in the trends in smoking prevalence over time between adults living in social housing and those living in other housing types. The proportion of adults who smoked declined year by year in people living in other housing types, falling by 24% over the study period, from 16% in 2015 to 12% in 2020. However, the decline among adults living in social housing over the same period was not statistically significant, falling by just 7%, from 35% in 2015 to 33% in 2020. And this suggests that not only are people living in social housing more likely to smoke than the rest of the population, the disparity in smoking prevalence and therefore the health problems that result from smoking is widening over time. So I'll leave it there, but I've just got a couple of take-home messages for you. First, there remain stark inequalities in smoking and quitting behaviour by housing tenure in England. People living in social housing are much more likely to smoke and they're more addicted than those in other housing types. They're just as likely to quit or motivated to quit, and they're more likely to use support to do so, but they're less likely to quit successfully. And second, declines in prevalence have stalled among people living in social housing despite progress in the rest of the population. This means that in the absence of targeted interventions to boost quitting among social housing residents, inequalities in health are likely to worsen. As such, tackling smoking in social housing deserves to be an urgent priority, particularly in the context of the UK government's commitment to levelling up. I'd just like to acknowledge the rest of the research team who contributed to this work and Cancer Research UK for funding it. Thanks very much.
Well, thanks very much, Sarah. That's really great. It's really, really great to have that evidence kind of shown and throughout the report. I know lots of the kind of social housing providers we spoke to as part of the writing the report kind of, mentioned that it's really to have that evidence to kind of provide, an impetus really about why they should get involved in this topic. So I'm going to hand over now to Robbie Titchmarsh, who will give us an overview of the report. There you are, Robbie.
Very much. I'll just pull my slides up and get going. How's that looking? Well, okay, perfect. Yeah, thank you very much. I am Robbie Titchmarsh. I'm a Senior Policy Officer at Action on Smoking and Health. And for those of you that aren't familiar with us, ASH is a public health charity established by the Royal College of Physicians to help eliminate the harm caused by tobacco. We don't attack or condemn smoking or people that smoke. Rather, we recognise it as an addiction that needs a public health response. We receive funding for our full programme of work from the British Heart Foundation and Cancer Research UK, and our work involves a mixture of information, resource and network provision, in addition to national level campaigning and advocacy. And today, I'm just going to provide an overview of this new report by ASH and HousingLIN. It's called Smoking in Social Housing, Supporting Residents and Addressing Inequalities. So I'm just going to start off with talking a bit about the report's context, how it was developed. And really the motivation for the report came, from that kind of case that Sarah's just been outlining. We know that people living in social housing face significant inequalities as a result of smoking, and those harms need to be addressed and prevented. And at ASH, we've been working on this area for a few years now. It's increasingly become a priority for us. And over that time, we've seen really great examples of practice, really good progress. So for example, we know through our annual survey of local authority public health teams that around 2 in 5 local councils in England are kind of doing work on smoking and social housing as part of their public health and tobacco control activity. That was in 2021, so just last year. However, what we have seen as well is that examples of practice are rarely sustained beyond a pilot kind of stage, and significant amount of work undertaken at the moment by councils is kind of still at a scoping or planning stage. So we kind of still felt there's a significant need to engage the social housing sector on this, and to make a really clear and focused case for social housing providers and councils to come together to work on this issue with a clear understanding of the mutual benefits of action and what action actually entails. So yeah, that kind of desire to engage the housing sector is really what led to the collaboration with HousingLIN. We wanted to ensure we weren't just coming at this from a public health perspective, but that, making a purely public health argument. And engagement with the sector has been really important to the report's development. So the kinds of things that went into that are listed on the slide here. So we had a roundtable with 10 social housing providers and kind of key sector organisations looking at kind of, what they might have done on this issue already, what their thoughts were about it, where they can see this kind of going and how we could best drive this forward. There were some kind of depth interviews with them as well, delving into those topics in more detail. We obviously had the new research from UCL that Sarah's just been outlining. Really grateful to them for kind of, providing that core background to the report. We've also included research by Landman Economics, which was commissioned by ASH to look at the impact of smoking on poverty, employment, earnings, social care, and kind of wider socioeconomic insecurity. We also had insights from our national survey of local authorities. We were really, grateful to receive feedback on drafts of the report from social housing providers and organisations like CIH and NHF. And the report also benefited from forewords from Janelle de Gruchy, who is the Deputy Chief Medical Officer in England, and Martin Hale, who at the time of writing was Director of Care and Support at Citizen Housing. So we're really pleased with this kind of joint piece of work. We're very grateful to HousingLIN for the sector expertise and engagement the report has benefited from as a result. And what we hope is that it's a really practical resource which kind of clearly speaks to social landlords' agendas as a result. So kind of diving straight into key messages from the report, I'll kind of read them out from the slide here. So firstly, smoking rates among people living in social housing are substantially higher than other population groups, resulting in health and economic inequalities. Inequalities in smoking rates between social housing residents and others have worsened in recent years. So those 2 points kind of Sarah's really helpfully been outlining for us already. And then thirdly here, tobacco control is a valuable and missing piece in social landlords' existing health and wellbeing activity. Fourthly, that successful collaboration between social housing and public health is already underway in England, but activity is inconsistent and therefore we need greater action and further support. And finally, that effective action would improve social housing residents' lives whilst delivering on shared ambitions for social landlords, central and local government, and the NHS. So, as I say, you've kind of already heard really about those first 2 points in the report, how people living in social housing are disproportionately affected by smoking, that they experience significant and worsening inequalities as a result. So I'm going to kind of focus on these last 3 points here, looking at what the relevance of this is to social landlords, the report's recommendations, and where we hope this report can go. So the relevance of this and the benefits of addressing smoking for social housing providers. There's lots of areas you could look at, lots of areas where this agenda kind of overlaps with existing priorities for the sector. Things like repair costs as a result of smoking damage, fire safety, things like even neighbourhood cohesion, issues arising from smoke drifting from one property to another. But the 2 big areas that kind of came out of our engagement with the sector, from the roundtable and the interviews and so on, are kind of firstly and probably most obviously the possibility to maximise the social value social landlords deliver through health and wellbeing improvements, and secondly by alleviating poverty and improving financial security among residents. And obviously what comes with that is more secure tenancies and financial sustainability for organisations. And the quotes on the slide here, I won't read them out at the moment, but you'll have access to these slides afterwards. These are quotes taken from the report. They're from kind of professionals working in the social housing sector, kind of speaking to those overlaps and, you know, how delivering on stop smoking support and improving that support to residents can deliver on those ambitions. So kind of, you know, thinking about this in a bit more detail, on that first point, as you know, many social housing providers are already committed to supporting the health and wellbeing of their residents, providing a range of services and support to get residents more active, supporting them to maintain a healthy weight, providing home from hospital services, meeting social care needs, and much more. However, as I've been saying, you know, at the moment, very few support residents on smoking or direct them to where they can get support as part of existing health and wellbeing offers. And for someone that smokes, smoking is likely to be, you know, the single biggest determinant of their health. And the single best thing a person that smokes can do for their health is to stop smoking. And without addressing this, the value delivered by other health interventions does risk being significantly undermined. And you know, as Sarah was outlining, there is significant motivation to stop smoking among social housing residents that smoke. We know that a majority of people that smoke do want to quit. And for social landlords committed to supporting the health and wellbeing of residents, understanding that desire and supporting residents to quit, directing them to available support is a clear gap, and one which, if plugged, could deliver huge improvements to residents' health. So that overlap is quite clear, you know, the possibility of maximising social value, supporting residents' health and wellbeing. And the second one here around kind of supporting financial security is worth a look in a bit more detail. So in addition to being hugely costly in health terms, we also know that smoking is hugely costly in financial terms. So the average person that smokes will lose almost £2,000 per year on smoking costs. That's equivalent to around £5 a day, £38 a week, or just over £160 a month. And that's the average cost for the general population of people who smoke. So we know that specifically for someone living in social housing on average, and you know, for people facing greater socioeconomic disadvantage in general, the impact of that cost isn't equal. So someone who smokes and lives in social housing loses on average 1/8 of their entire disposable income to smoking costs. And for someone who owns their home and smokes, the impact is about half that. So in 2020-21, around 1 in 4 social renters reported finding it either fairly or very difficult to afford their rent, and around 1 in 10 reported currently being in arrears. And we know that smoking is already having a huge impact on household finances and poverty in general. So research by Landman Economics for ASH estimates that when tobacco costs are taken into account, an additional 250,000 or over 250,000, 246,000 households that are social rent in England fall below the poverty line. And all of those figures I've quoted, you know, just then, they're the latest available data, but they are all pre-cost of living crisis, you know, the economic shocks that we're facing at the moment. So it's likely that it's a situation that's going to worsen rather than improve. So supporting someone to stop smoking can be a huge financial boon, one that is unusually rapid in effect as well. You know, it puts money back into people's pockets, back into household incomes from day one of a quit attempt. And we're being realistic about this in the report. We go into, you know, a bit more detail on all of this, obviously, and we're not suggesting it's a silver bullet to our economic situation or an alternative to existing financial support offered to residents. But, you know, as Sarah was showing, there is huge motivation to quit among social renters that smoke. And when there is so little kind of wiggle room left in household budgets, every opportunity does matter, particularly one that could save someone, you know, around £40 a week. So it is something that deserves serious consideration alongside existing financial support offered to residents. And it might be, you know, that additional bit of support that they get from quitting might be the kind of boon they need through acute financial stress or kind of more sustainable finances in the long term. And obviously, as I was saying, in tandem, that has benefits for the organisation as well. So those are the kind of big two areas where tobacco control fits into social landlords' agendas, and those are the two big things that kind of came out of our engagement with the sector. So, what are we proposing kind of be done about all of this? These are the report's recommendations, and they're broken into 3 sections. Recommendations for social housing providers, for local government public health teams and the NHS, and for central government. And our recommendations for the local level stakeholders are very much focused on collaboration, improving support available to people that smoke and live in social housing, whereas the national recommendations are focused on ensuring that the resource and support is available to enable and facilitate that local delivery. And in the report, there are case studies and examples alongside these recommendations to kind of show explicitly what we mean. And we'll hear about some of that great practice that's underway in a few moments as well, so I won't spend a lot of time detailing this. But seeing as we're on the happy hour, I'll focus briefly on the kind of recommendations for social housing providers. So our recommendations here are primarily about recognising the impact and relevance of smoking to residents, to prioritise action on it across the organisation as part of activity designed to support residents' health and their well-being and their financial security. And action doesn't look like a blanket ban or punitive measures with enforcement. It's about joining up and connecting residents with existing support, tried and tested methods to quit. And the first step in that really is that local level collaboration, building relationships between social housing providers and local government public health teams, with discussions taking place at that local level to understand what can be offered and pursued locally. And that might include things like improving communications out to residents, informing them of where they can get help to quit, directly referring them, training frontline staff to do that, or even providing them with stop smoking aids like e-cigarettes. But fundamentally, it is that partnership between social housing providers and local government public health teams that's a key first step, and where this all really needs to begin. And that's something where these case studies today, you'll hear that's kind of where it's come from, is just initial engagement and collaboration. So again, there's some kind of quotes on the slide here kind of speaking to those relationships. And again, those are all in the report. So I'll just not spend too much further time here, and I'll kind of move finally on to where we hope the report can kind of go from here. So obviously we'd like to see those recommendations taken up. And what we hope this report provides and kind of does is equip both social housing providers and local government public health teams with the key information and tools they need to open those conversations, understand the relevance of this work to them and its importance. So in terms of what all of you can do with this report is to, for housing providers, reach out to local government public health teams. And for any housing providers on this webinar, ASH is very happy to facilitate this and kind of put you in touch with the right people in your local area. And for local government kind of public health teams on the call, share this report with local housing providers, share the recording to this webinar once it's available. And have an informal meeting with them, discuss what you can collaboratively do, what the ask and offer is, and just how you can better kind of improve residents' access to stop smoking support, using kind of some of the ideas in the report as well. And in terms of what we'll be doing at a national level, we're very keen and stand ready to kind of support practice wherever we can. So if this is something you're starting to get off the ground, or if you'd like to but feel you need additional support, again, please do get in touch, and we'll provide that support as best we can. We'll also be publishing further resources to support your work on this, including kind of a more comprehensive compilation of existing practice, the key lessons from them to kind of help initiate action elsewhere. We'll also be publishing findings from some insights work we've commissioned with social housing residents, looking at smoking and quitting behaviours, messages that resonate with them, and so on. And we'll be continuing to advocate for this issue at a national level. So very quickly, the image on the slide here is a recently published government commissioned independent review on tobacco control policies that included within it a recommendation for local authorities to prioritise comprehensive tobacco control measures and stop smoking support for residents living in social housing. And we'll be, keen to see that included in the upcoming Health Disparities White Paper and upcoming National Tobacco Control Plan. And yeah, so we'll kind of be continuing to ensure this is prioritised at a national level, ensuring that the resource and support is there to kind of support the local delivery on this. So that's a kind of rapid trot through the report and where we'll be going next. But yeah, I'll hand back over to you, Les, and we can hear about some of the work that's underway.
Well, thanks very much, Robbie. That was really great. Yeah, I'll hand over to Madeline now to kind of give that insight on what you're doing, Madeline, at Untitled Homes.
Thank you, Lois. I'm just going to share my screen. Is that sharing okay?
Yes, yeah, we can see it. But if you want to go full screen, so if you just go at the bottom right of your screen, next to the minus sign. So the very bottom of your screen. No, the bottom. Madeline, would you rather I share your slides on your behalf? You're muted at the moment, so I can't hear you.
Yeah, if you can, because I'm having trouble. Sorry, I'm having trouble sharing it now. The Zoom call's gone over the bit that I need to minimize. Sorry, it didn't happen on the run through.
That's fine, no problem. I'll share them if you just let me know when you want me to go to the next slide. Brilliant.
Okay. So hello and welcome. I'm Madeline Jeffries from Untitled Homes, as Lois already mentioned. So Untitled Homes is part of the flagship group. We are a social landlord with approximately 30,000 homes. We have 3 housing associations within us, and we have a mix of general needs customers as well as customers in sheltered, supported accommodation as well. So a really broad range of customers. And we operate in the East of England area. What I'm going to share with you today is how we came across this concept and the idea of working with ASH, what we've done and what we've learnt so far. So first of all, we had a discussion at one of our team meetings regarding health and what else we could do to help our customers, and we were just having a sort of free-for-all session, and we started speaking about what we could do to improve communities and health of people in the communities, and smoke-free homes was something that come up. So we set the task for one of our housing officers to do some research, and then we come across ASH, and then we thought, wow, our life will be easy now, because they've done a lot of this stuff for us and they want to work with housing associations. So it was a real simple, once we got the connection with ASH, it was really simple to get the information that we needed. We didn't have to kind of trawl through and get all the stats required to convince people within the business this is a good idea. So I can well recommend getting in contact with them as soon as possible if you're going to do something like this. And they put us in touch with, as Robbie mentioned, the public health teams that we needed. So we work across Suffolk, Norfolk, Essex and Cambridgeshire. So the initial idea was looking at people's health, but we wanted to think, because we're a housing provider, what we wanted to do is make sure we tackle this from the right angle. And I think that's important, because we are a landlord at the end of the day, and we can't be seen to be dictating what people are doing and getting involved with health, and where do you draw the line. And there was a lot of questions around that. So we spoke quite a lot in the beginning about what we were going to do, how we were going to promote this, and how it links into us as a social landlord. So we have gone down the route of branding it as a smoke-free home, so centering it around the home, but obviously in the background when we're talking to the tenants and the staff, we're thinking about people's health and the other impacts it can have. But that's why we've come up with the branding of smoke-free homes, to focus it around our role as a landlord and the connection to the home. So if you could move on to the next slide, please, Jerome. Thank you. I won't go through a lot of the stats, obviously, because Sarah and Robbie have kindly covered a lot of that off. But I think it's been apparent from what we've seen so far that actually there is a real issue with those that live in social housing, and there is a need for something to be done by social landlords. So that's why we wanted to play our part in this. We wanted to also take a very supportive approach. As I've mentioned already, branding was important, but also we don't want this to be an enforcement approach. What we don't want to do is say that people can't smoke in our homes, because I believe, and the company does, that's not appropriate to tell people what to do within their own home, but also it's not something that we're going to be able to, if we did decide that we were going to have an enforcement approach, it wouldn't be something that we would be able to monitor and police. It would be very difficult to track who is smoking in their homes at a particular time. So it's very much a supportive approach. It's not about enforcement, and it's about encouraging people to quit smoking if they want to. And as I've already mentioned, we are working with NHS, county councils and public health, who are the experts. So as a social landlord, we want to play our part, but we're not going to start dabbling in stuff that there's experts out there for. So it's been really refreshing to have the really professional support from ASH and the other external agencies as well. So that's been brilliant. If you could move on to the next slide, please, Jerome. So it was really easy, as I said, to get all the information. This is some of the sort of headlines that we put in our report that we did to our local housing boards to pitch the idea. And as I said, I won't run through those because they've been covered a lot already in the two previous presentations. But in addition to the obvious health benefits for our tenants, where it sort of links into social landlord more is around the finances in terms of rent collection. That's a point that we sort of pitch, because if people are stopping smoking, they are going to save a lot of money, so therefore it could have an impact on their ability to pay rent and more security. Property condition is a big one, around smoke damage in homes, as well as communal areas, cigarette butts. We do get a lot of complaints coming in around cigarette butts in communal areas and things like that, and also the fire risk. We have had, I think, just checking my latest stats, I think of the 30 fires that we had in a 18-month period, I think it was 12 of those were related to smoking related materials, not necessarily cigarettes, but smoking related materials. So it really could have a big impact on fire risk in the home. Also as well, a more of a tenuous link, but around in some of our communities, there is the purchase and sale of illegal tobacco products. So if people are not smoking, there's not the market for those to be provided. So that's another sort of link in. So if you could just pop onto the next slide, Jerome, please. Thank you. Also put some of the stats on here as well that we spoke about. So when we looked at this, we looked at all the different ways that it could benefit our tenants and benefit us as an organisation. And what we did to start off with, we had some focus groups with our colleagues in the business to see what they felt. As I said before, we needed to be careful because we didn't want our colleagues to feel uncomfortable talking to customers about this, because it is slightly outside of the remit of landlords. So we did have some pushback in some of those discussion groups around challenges. We're talking to people about smoking, what next? Are we going to be telling them what to eat, or are we going to be talking about gambling, all sorts of things? So but we had some really open discussions about that and the benefits of this, and as I said, we linked it back to how it helps us, so that the property damage, etc. And we had some really good comments from people that currently smoke and say, I wish, can you help me as well? And obviously, yes, we can make staff referrals through, which I'll talk to the referral system later. So we had some really good things come out of the discussion groups, both challenges and some really good support for it as well. We then went to our tenants to ask them what they thought about it. We, in hindsight, and what I would say that we have learned is to perhaps we could have involved our tenants earlier on in the process. I think we sent out we were sort of a bit limited on time because we wanted to launch it. We didn't want to rush it, we wanted to launch it through. So we did a survey out to tenants, but I think in hindsight we could have had some smaller discussion groups with our tenants as well, to get a bit more insight and design the programme perhaps a bit more around them. But we did go out to tenants and we asked them whether they were a smoker, whether they would like to quit, just to get some ideas on numbers, because it's not information that we've collected before. When we sign people up, we weren't asking whether they're a smoker or not, and we had no idea how many of our tenants smoked or had smoked in the past or were interested in quitting. So we sent that survey out, not to everyone, we just chose a sort of sample group, and that's something we will continue to do as we go on. So I recommend that perhaps some earlier work is done around that in the future. We then, after we'd spoken to tenants, we then pitched the idea to our local housing board, just to make sure that we had support from them, and it was like pushing against an open door, really. I was really pleased with the support we got from our local housing boards, which was great. So then once we got the go ahead, we then decided what we were actually going to put into place. So if you could move on to the next slide, Jerome. That's all right. What we agreed is that we've added a clause to our tenancy agreement. We were actually in the process, luckily, of redrafting our tenancy agreement, so it was good timing, and we rolled that out. So they now have a clause in them encouraging people not to smoke in their homes. So as I said before, it's not an enforcement clause, but it is a the wording is, and I'm happy to share the wording with someone, if anyone on the call, if they want it, but it's something along the lines of that we promote smoke-free homes, and we would encourage you to think about the impact of others, and etc. But it doesn't actually say you cannot smoke in your home. With our new build homes as well, we are promoting those, the new build homes that we have about probably about 200 coming through this year. We're promoting those as smoke-free again. It's not as much of an enforcement, but because they are a brand new home, and a lot of people, when they move into a new home, think, oh, I won't smoke in it. I've tried to quit, new home, new start, and all that. So we are promoting those as smoke-free, just with some working with our development team to get some door hangers to go inside, you know, like you put over the doors perhaps when you sort of visit a hotel, those sorts of things, just to sort of promote that. So when people moving in, I think just a reminder. We then ran training with all of our housing teams, which was kindly arranged through, we got the contacts through ASH and are run by the NHS. So this is online training, just some high level training for the whole housing teams on how to broach the question with people, and how to ask the right question, and what sort of high-level support advice they can give. And then we've had some more in-depth specialist behavioural training with a select group of people from the team. The behavioural training is really good, actually, because although that is centred around obviously the behaviour of stopping smoking, it's also useful, I'd say, as a landlord, it's useful for other things. So behavioural patterns in perhaps antisocial behaviour or rent arrears, things like that. So it's really been useful training. So we've been really grateful for that. Then what we do, we ask our new customers as they join us now, we ask if they smoke. Appreciate that information is out of date as soon as we ask it, almost, because people can stop all the time, but at least we're getting a number, some idea of how many people that actually move in with us do smoke. And then we're asking at that point whether they'd be interested in stopping smoking, and that's where we're making the referrals. So as I said earlier, as a landlord, we are not then helping people to stop smoke, but we get that referral over immediately to the professionals, and we've got links with all of the relevant agencies within the counties that we work in, and that's the key. We've got a really easy referral form, and we've got an agreement with those to get some reports on the stats. So depending on how many we send over, say we're sending 20 people over to stop smoking, they can let us know how many people actually engaged at the first point and how many people went through and actually stopped smoking, which is great. So that is asked as standard when people move in now. And we haven't really had any pushback from tenants. No one sort of questioned why we're asking that. It just seems quite natural as part of the application form. I think because it's quite standard in private renting to have a no smoking clause. I think some people are expecting to be asked anyway from a landlord whether they're going to smoke in the property, a bit like, have you got any pets sort of question. And then also we are making referrals at other times during customer contact, and this is mainly, we are finding that it's mainly from our rent team when we're doing budgeting planners and things like that with people. So if they are talking, you know, for example, they may well be saying, oh, you know, I do spend £50 a week on cigarettes, I wish I could quit, or those sorts of things. That's where we can really come in and pick that up and make that referral. So that's been great. We're also carrying out a number of tenant campaigns to link in with the stop smoking days, Stoptober. So we're linking those in with the relevant times of year, and ASH have been really helpful in letting us know what campaigns they've got going on, and also literature has been provided for those by the public health, which has been great. There's no need to reproduce stuff because they've already got all their own comms literature, so it's been fabulous. And we have also designed a insert into our sign up pack. I should have mentioned that earlier. So we've got a what to do if you want to stop smoking insert that now goes electronically into our sign up pack, so people get that at first point of contact. And then what we're doing is the second stage now, which we haven't yet finished, exploring whether we want to ask tenants to sign up to a sort of voluntary smoke-free home pledge. Again, not something that we're going to police, but just a bit, something perhaps a sort of social media campaign or something on our website, so we can get a counter and see how many people have sort of, so it ticks up, so tenants can look at it and see that, you know, I'm not the only one, I've committed to that as well, and a bit of sort of camaraderie between tenants and thinking, oh, someone else is doing it, so I'll sign up for it as well. So just thinking about whether that is worth it, whether we can whether we'll be able to use that information anyway. So that's something else that we're looking at the moment. It's early days. We started in April, so we're just almost at the end of the first quarter. So we will be producing a report on the numbers we made referrals for, etc. So we'll be sharing that with ASH as we go forward, and we'll be doing that each quarter and seeing what else we can do. I think the next slide, Jerome, if I just move on to that. Yeah, so this is just, I've put this in here. So this is just what when we briefed this out to all the teams, this is the kind of thing that we wanted people to do, and it might be useful, I thought it might be useful to share if you were going to sort of do any briefs out to your teams. So basically, we just asked people, we briefed out to all the managers across the whole business. We asked people to just sort of create some excitement about it and positivity, because we wanted it to be a positive project and not sort of like a Big Brother stop smoking thing. We've also made sure that people pass on any feedback to the key people that are running the project, because we want to know what tenants and colleagues are saying. We want to know if these sort of conversations are offending tenants or they're really getting some great feedback, and we're asking staff to come up with new ideas of how we can work towards it, and also getting everyone behind booking the training. Finally, I just want to say as well, the other thing that we are working on with our health and safety team is and the sort of HR team is around the impact this will have on our colleagues as well, because we've got a lot of contractors going in and out of homes, and something we did put in the report for our local housing boards was the impact that this could potentially, the positive impact it could potentially have on people not having to work in a smoke environment. So obviously when we go around to do work, we ask tenants to stop smoking, but if they have been smoking within the last sort of 30 minutes, etc., still hanging around. So that's something we're looking into that of how can we measure that impact, and what else can we do around the colleague side of it. Just whistle stop tour. Apologies for the issue of sharing the slides at the beginning, so hopefully that was useful.
No, that's really useful. And just for the sake of time, I'll move on to Andrew, because I know we are running over a bit, but I did want to interrupt you because that was really useful, and I see some questions coming in, so we'll get back to them. But Andrea, I'll hand over to you.
Thank you, and thank you everybody for joining us today. I think Jerome's going to share my slides.
Yeah, I'm on it.
I didn't have the confidence to do.
Oh, that should be it. Can you?
Yep.
Can you see it? Yeah, perfect.
Yeah, I can see that. Yeah. So again, just a real whistle-stop tour of what we're doing in Sunderland. A very brief overview of this pilot project. I am mindful that we are mid-procurement and mid-project planning, so the details will be very limited, but obviously the collaboration I can share, and how we've got to the point where we're at now. So if you want to go on to the first slide, Jerome. So when we looked at the research from ASH around housing tenure in Sunderland, we know that there is a large proportion of rent from social housing within Sunderland. In Sunderland, we have about 35,000 social rented properties, with the main register provider being Gen2 Housing Group. We were aware through research and through looking at what we can do to help this high prevalence group. We were aware of work done in Greater Manchester in the Salford Swap to Stop scheme, which was piloted in 2019, and they got results of over 20% quit rates amongst this key demographic by offering e-cigarettes, starter kits, and the associated products for those as well. So what we thought in Sunderland is, could we do something similar with our partners within Sunderland? Salford was a 6-month pilot of 1,000 social housing tenants. What we aim to do in Sunderland is a 3-year pilot with 3,500 social housing tenants, which will be 10% of Gen2's stock. So it is quite a significant scheme. It's quite a significant pilot. Not only will it have a huge impact on smoking prevalence numbers within Sunderland, but it'll also garner a great, because it's over 3 years, the data collection will continue over the 3-year period. It will also give us a really good idea of whether people go back to smoking after they've tried the e-cigarettes, whether they continue with e-cigarette use, whether they go completely give up everything after the pilot. Do you want to go to the next slide, please, Jerome? So what we did in Sunderland is Sunderland City Council reached out to our partners and our commission services to identify if we could create a similar scheme to Salford's, and we've called our project Swap Smoking Sunderland. Just again, the alliteration, it's something pleasing about alliteration. And we developed a project group that consisted of Sunderland Public Health, obviously myself, our Sunderland City Council comms partner, Gen2 Housing, the commission service, which is Sunderland Specialist Stop Smoking Service, and our partners with Fresh North East, who are a dedicated regional tobacco control programme who work very closely with ASH. The partnership and collaboration came very easily and very quickly. Everybody was very on board with this project from the sign up. Gen2 Housing, a lady called Julie Walker from Gen2 Housing, we had initial conversations. She took it to the board of directors, who were all very, very keen, very much for the reasons that Madeline went through, the void turnaround, you know, the quality of void properties, the ability to pass those properties on very quickly to another tenant, illicit tobacco, the health of residents, the financial benefit to residents, and that smoke-free homes for children and young people. Gen2 absolutely were on board with that straight away. Our Sunderland Council comms partner works very closely with Gen2's comms and with the Specialist Stop Smoking Service comms to make sure that we do have that whole system approach to it, that we are all saying the same thing, and that branding encompasses of all 3 of those partners. This isn't Sunderland City Council leading this. This is us in partnership with our housing partners and our colleagues from Fresh and our colleagues from the Specialist Stop Smoking Service. Would you like to go to the next slide, please? So again, the proposals for phase 1. So proposed phase 1 would be to identify the wards in Sunderland with the highest smoking prevalence and the mixed tenure social housing density. Again, our colleagues from Gen2 Housing and the Specialist Stop Smoking Service have worked together on this to look at, we don't just want to target housing tenure that is flats or is bungalows or is a very high density of smoking of family homes. We want to make sure that there's a good mixed tenure there. So we're targeting intergenerational. We're targeting routine and manual workers. We're targeting people who are unemployed, people who work at the NHS or within the council. We are aware also that there's a lot of council workers who do live within Gen 2 housing. So our partners have worked very closely on that. Following on from that, they hope to establish clinics in these phase 1 areas so that the accessibility and availability to that support is on the doorstep. People don't have to go out of their way to be able to access this. We are working on an agreed pathway of care with the specialist service. Like I said, the procurement of goods is in process at the moment, and the comms and promotion strategy is something that is being worked on amongst all 3 of our partners there. Next slide, please, Jerome. So this is the proposed care pathway. So from recruitment, which will be done through Gen 2 housing, the housing advisors will be given training and support on very brief advice through the Specialist Stop Smoking service. So how to ask those questions, how to then refer on to the service and get people onto this pilot scheme. Again, I'm totally aware that it is a difficult question to ask if people are smoking, to give them that option. Gen 2 housing, very much like Madeline said in her previous slides, Gen 2 housing are very, very keen for this not to be an enforced thing. It's a choice. But what we're doing is we're offering these tenants a choice in their stop smoking. We're offering them a product and the support that isn't actually available at the moment, and making sure that they are supported throughout this whole journey. So you'll see there on the proposed pathway, following recruitment, there is a series of 7 appointments. The 12-week appointment will be the last. However, with new NICE guidance that says support will be offered for as long as it's needed, the e-cigarette will end at 12 weeks. But if that client requires further intervention and further support, that will be offered through the Specialist Stop Smoking service. We wanted to make it really clear that this isn't a pilot. It's not a data gathering pilot. This is to improve the lives of residents. So should that pilot finish at 12 weeks and that resident require further support, that will still be offered. It will still be offered through nicotine replacement therapy and behavioural support. Following the exit to the pilot, there will be a 6-month telephone follow-up again, just to see how that person's doing. Are they still on e-cigarettes? Are they still using nicotine replacement therapy? Have they returned to smoking? Or are they completely quit? Next slide, please, Jerome. So the proposed intervention will look like this. The eligibility for the project will be checked against the inclusion criteria. Nicotine dependence will be measured at initial consultation. Products will be chosen with guidance from a specialist advisor. Support and NRT products will be discussed and advised as per client need. Through the amount of research we've done talking to people who have used e-cigarettes, like the NHS and mental health trusts who use e-cigarettes as a smoking cessation quit device, supporting NRT is often used in conjunction with e-cigarettes. And again, that is something that we're keen to offer these residents, to give them the best chance possible to quit. It's not a data gathering exercise, it's a lifestyle change for these people. We don't just want to offer an e-cigarette so we can get that data. We want to make sure that we're giving them the best chance possible to quit at the end of this. So if NRT, accompanying NRT is needed, then they will be assessed on client need. Behavioural support, again, will be offered through the Specialist Stop Smoking service, and a schedule agreed for that. They will get it over the 12 weeks, whether they wish to engage with that, whether they wish to have longer than 12 weeks, will be discussed as per client need. And CO validation will be done at each consultation. And CO validation is just to make sure that that person isn't using tobacco or cigarettes throughout the pilot. Next slide, please. So as I mentioned there, the inclusion criteria that is proposed is that the client is a current smoker, They are not currently on any active quit journeys, so they're not currently using any products or medications at the time to help them quit. They are over 18 years of age. They are Gen 2 tenants. And if they are pregnant, there's a liaison with the midwife. However, after speaking to the head of midwifery at Sunderland, they don't feel that any liaison with the midwife is needed because there is no contraindication of e-cigarettes in pregnancy. However, our specialist smoking advisors have said that they will continue to liaise with the midwife as they would through any pregnancy quit attempt. Next slide, please. These are our evaluation expectations. We want to know who did we reach, what were their occupation, ethnicity, gender, age, what the efficacy of the e-cigarette as a quit attempt was with behavioural support, where that was engaged with, and what the efficacy where behavioural support was not engaged with, the efficacy of e-cigarettes with support and NRT, and the efficacy of e-cigarettes without support and NRT. But that will be entirely client choice. If 100% of our clients decide that they want accompanying support and NRT, that's what they'll be offered. And again, that continued cessation at 6-month follow-up. That's the end of my slides, but I just wanted to go through another couple of things. E-cigarettes and vaping are quite a contentious issue. I'm aware that there's a lot of discussions around e-cigarettes. They are used currently by the NHS. They're going into the NHS staff offer as a cessation device, as an NRT, and they are supported by NICE as a cessation tool. It's not easy to say. And then now endorsed by Javed Khan through the Khan report, who talked about vaping and e-cigarette use within smoking cessation. The partnership between ourselves, between Gen 2, between Fresh, and between our comms and the Specialist Stop Smoking Service in Sunderland, we have fortnightly meetings. We make sure that we are really tight, that we're working through every issue that comes up. That collaboration will be what makes this pilot successful, because each of those partners is really invested in getting this to work and making the lives better for those Sunderland tenants. Thank you.
Brilliant. Thanks very much, Andrea, and thanks everybody for your presentations. Really interesting. I'll go straight into the questions. We've had some really great questions posted so far. If anyone else want to ask or upvote any questions, do so in the Q&A box. So the first question we've got was from an anonymous attendee. Will there be any national resources, PR or media campaigns specifically targeting social housing residents? I guess Robbie and Sarah, I guess it's whether you are aware of anything apart from obviously the report that we're writing in relation to that.
Yeah, I can. So there's nothing in terms of kind of mass media campaigns. There aren't any kind of at the moment that specifically target social housing residents that smoke, and in general, it's something that ASH has kind of been calling for as a part of kind of additional funding for tobacco control and public health, which has been severely cut in recent years. We've seen a significant reduction in funding available for mass media campaigns in general, so things like Stoptober and so on. So yeah, I mean, that's something that we would love to see more of, is more mass media campaigns, and one specifically targeting groups that face higher rates of smoking. So as kind of part of a range of recommendations we've made through the APPG on smoking and health, that's something we're hoping to see.
Brilliant. Thank you, Robbie. Great, and I've got a question from Sarah Davis, and thank you, Sarah, for reviewing the report and your support from the CAH as part of that. And it's a question for Madeline. So it's around kind of the clause. So do you tie the clause with any incentives at all to encourage people to take up support that you offer?
We haven't done so far. I think the support that's offered through the different agencies we refer to is really comprehensive and one-on-one, and really great that we haven't had to wrap it up with anything. I think the way that we've been given the training to ask the questions are really identifying those people that do want to quit. So I think that is enough incentive to them, because they want to stop smoking, and what they're going to get from the referral is quite beneficial. So we haven't had the need to. Not to say that we wouldn't consider that in the future if it was needed to get more uptake.
Thank you. And I guess another question that's been posed to you, Madeline, is around kind of the tenant survey that you undertook, and what sorts of things kind of people said when you were doing that, what their reaction was.
Yeah, so I think, and we probably will repeat the survey, because I think we wanted to ask more questions around people's views on what we could do as a landlord. So I think we need to go back out to do that. So, but what we did ask is, we just asked questions around trying to get an idea on how many people smoked and whether they agreed with the proposal for smoke-free homes. What was really interesting is that the majority of people agreed. We asked if they agree, disagree, or don't mind about the smoke-free homes, but we had a real split in our geographical areas we operate in. So the less people agreed in our Victory Homes, which covers the north of Norfolk, which is I don't know if anything to do with the demographics there or whatever, but it was really interesting to see the different responses. So the agree responses ranged from 51% being the lowest to 81% being the highest, and then we had New Tide Homes was about 74 in the middle. So that was quite interesting. So we asked whether they agreed with it. We asked whether anyone currently smoked or vaped inside their home, and their own smoking statuses, and whether they agreed with the landlord encouraging people to take advice to stop smoking. So that was quite limited, but I think we will look to go back out to ask further questions.
Well, thank you. And I guess on the same vein, actually, I wanted to pose a sort of similar question to Andrea, really, around whether any of the sort of tenant, undertook much tenant engagement with sort of Gen 2 tenants, and whether there was much kind of what sort of narrative might have been around that.
Not yet, we haven't. It's something that we're hoping to do as part of the proposal. Yeah. The work that we've done so far, like I say, it's very much in the proposal phase at the moment. The proposal was agreed by Sunderland Public Health SMT, and it's still very much in planning and working group stage at the moment.
Thanks. Okay, I've got a question that's been upvoted, which is, who is funding the stop smoking products from I think it's that full name is from the Tobacco Cessation Specialist. Robbie, are you able to give a bit of background around kind of funding of stop smoking products?
Yeah, well, so I think kind of from the examples I'm aware of, it's usually the the council kind of or it might be kind of through the stop smoking service. And there have been examples as well though where we've seen it funded by social housing providers. So yeah, I mean it can depend really. I guess, Andrew, in your case it will be yourselves funding the kind of programme.
Yeah, the funding for the 3-year pilot comes from the council.
Yeah. So yeah, I think often obviously those are kind of providing e-cigarette starter kits and things. That's something that councils will do anyway through their stop smoking services, or often they will, not always, but quite often. But that's not to say that there obviously is the benefit there to social housing providers and a kind of return on investment for them as well. So hopefully it's not something that would be ruled out completely. But yeah, it kind of depends on the local arrangement.
Brilliant. Thank you. Thanks both for that. I've got a question, I think another one from Madeline around kind of data. So do you have any data on how much more it costs you at the end of a smoking tenancy versus a non-smoking tenancy to bring the property back to a lettable condition? And perhaps others might have data on this. Is it something you're looking at?
We don't. It's something that we want to have data on. We don't have it, not because of difficulty around understanding what damage is caused by smoking, but just because our data on our voids and our cost of those is quite limited at the moment. But it's something that we want to build in to understand what we're having to rectify and whether that could be attributed to smoking in the home.
Well, thank you. And I guess we've got another one for you, Madeline, as well, is around managing relationships. So how do you manage relationships with stop smoking services, being such a large housing provider? Yeah, if you could give a bit of detail about that.
Yeah, I think it's really lucky that because we only actually cover 4 counties. It's different from local authorities because we've got I think 19 of those, but I know some housing associations have hundreds. But because the public health organisations have done all the linking up for us, and they've just taken that on, we've only actually had to liaise with the 4 different counties, so we haven't found that much of a problem. And as I said before, ASH have been really useful in putting us in touch with the relevant people. So it hasn't been as difficult. I've worked on, just as a comparison, I've worked on a domestic abuse campaign before where it was really difficult to get in with all the local partnerships because there were so many, but because the public health are sort of coordinating that, it's been really easy actually.
Okay, thank you. Yeah, and I'm sure, Andrew, I'm sure that's something that we could kind of talk about offline as well, if you were interested in that. Okay, and I've got a question from Paul Pemberton, which I guess is to any of you, which is, can he ask the presenters, have they linked in with any fire and rescue services in their intervention service offers and activities, such as fire home safety checks or safe and well visits? Don't mind if anyone wants to go first. Andrew, is that something you're doing, or?
Yeah, I'll go first. We do have a good relationship with Tyne and Wear Fire and Rescue Service. They are part of our smoke-free partnership, and they do benefit from very brief advice training. So when they go out on their fire safety checks, the fire officers have had very brief advice, so they can offer that, that initial discussion. That is something that I would advocate anybody who's going into somebody's home, that very brief advice, because that opportunity for making every contact count is vital in I don't want to say the fight against tobacco, but in smoking cessation, any conversation that anybody going into someone's home can have is really, really vital. So we do really promote that very brief advice, which again is offered from our specialist stop smoking service.
Great, thanks, Andrea. Madeline, have you had much conversation with fire and rescue services at this stage?
We have had some very limited conversation. What we're hoping to do is the first round of social media was connected to health and wellbeing and stop smoking, and we're looking, as I mentioned, we've had quite a few fires that are linked to smoking materials, so we're looking at taking a slightly different angle for one of our future campaigns on stop smoking for fire safety rather than the health aspect. So we're looking at that stage, but it's been quite limited. Thank you.
And we've got another 2 questions just before we kind of wrap up. So we've got one from Sarah, which I believe is one from Robbie around the timescales for the insight report with social housing tenants. So she's mentioning,
hopefully very soon. We've just had, as I say, that was a kind of piece that we commissioned out to an organisation that kind of, do kind of insights work. So we've had the kind of main report on findings back from that. So hopefully within the next couple of months, we'll have packaged that up into something that's quite practical alongside alongside a bigger compilation of kind of existing practice from across the country.
Thank you. We've got a question from Kate around kind of sharing reports that went to boards that to seek support, and I guess the best thing to do there is obviously we'll liaise with Madeline and Andrea around any kind of documents that they found really useful in this piece of work, and if you're happy to share those, Madeline and Andrea, then we can pass those on. Brilliant. Okay, we've come to the end of our questions. We are just a little bit ahead of time. If there's no other questions that are coming through, just want to end the session by saying thank you very much for coming to this week's happy hour. Next week's happy hour is on the 5th of July is on technology enabled care in housing, and that'll be supported by Tunstall. And for more information about kind of how the HousingLIN consultancy can help you, please do kind of get in touch with info@housinglin.org.uk. Thank you very much for coming, and thanks to the speakers again. Thank you. Have a nice evening.